Hello, everyone. Uh, so we are back with another episode of Allergy with Legends. And today we have Dr. Gayatri S. Pandit, consultant ENT surgeon and allergy specialist, Samarth ENT and Allergy Center, Manipal Hospitals, Bangalore, and Medicare ENT Hospitals, Bangalore. Dr. Gayatri is the president of Allergy Asthma Network of India. She's also the academic director for Medtrain Allergy Asthma courses. She has various publications to her credit. She is a ENT convener for Indian Academy of Pediatrics Allergic Rhinitis Module 2023. She's a core committee member of Indian Guidelines on Allergic Rhinitis published in 2022. I think that's one of the pioneers for allergic rhinitis guidelines in India. And she's author of the book Coughology, and she's faculty for various allergy training modules across India and a very good friend and colleague. So, Dr. Gayatri, thank you for joining us for this Allergy Legends interview. And to start off with, how can you briefly describe yourself, not as just a doctor, we know as a person, but just for the benefit of others? How would you describe yourself as a person?
I wish somebody else would describe me than describing myself. Okay, so keeping a doctor apart, I love music. I love Kannada literature. I like to be with nature, and I'm a bit of a trekker too. A little bit of a gardening too. Reasonably organized and disciplined. My people at home call me little bossy too.
Right. I think I know that your love for nature and gardening, all that, I think has also given you interest in aerobiology. And I think that you are one of the foremost authorities on aerobiology in the allergy perspective in the country as well. So I think, is that what also is one of the factors that drew your journey into allergy? Specifically, I know you have contributed a lot for pediatric allergy too. And what keeps you passionate even today?
I got into allergy practice maybe for the reason that I saw so many people suffering with allergy in my family. So that was the first, intuition for me to pick up this topic more into pediatric allergy later. Uh, Maybe because of I was surrounded by pediatric allergy colleagues all the time, and that somehow in one or the other way that we would discuss our cases. And I also work with Dr. Gaurav Medicare, where we had to deal with a lot of pediatric airways, pediatric allergies. And what keeps me passionate is probably what the result that I have seen. You know, so when you see the result and when you see that what difference that you have made, that work is never a pressure. It's always a pleasure, and it's a passion continues there.
I think those words are quite important that when our youngsters who are venturing into allergy practice look at instant results with the measures, I think it is important for them also to understand that it takes a lot of time for them to spend with the patient and also the results which would come through. Coming into the journey of allergy, what was your first exposure to allergy or in the field of immunology in your career?
Uh, the first exposure was actually probably Dr. Rudra Prasad. He was one practicing in Kim's Hospital earlier. And then in my setup, I wasn't doing allergy practice initially. So we would pull up all our allergic rhinitis patients, asthma patient, and he would come in a day, and he would be doing allergy workup for me and for my patients. But unfortunately, in an road traffic injury, he lost his life. And that's where I already had a patient and I had to learn. And just in a month later, Indian Academy of Allergy, that time, under guidance of Dr. Pendukar Anand, conducted the first residential allergy workshop. So it was a 5-day residential workshop there in Mysore. And that was my first learning of allergy, immunology, and it was very, very fascinating for me because so far I had only known allergic rhinitis and nothing beyond. So it was really nice to know the extent of that allergic disorder spread, and also it was really fascinating for me those 5 days. I am very thankful for that, the first program which I attended.
I'm glad that you chose allergy to be your specialty, and it was again for the specialty of allergy. And like you mentor so many young practitioners in the field of allergy education, can you recall a moment or mentor bar mentors who influenced your choice to specialize or excel at this field?
I think the answer is very, very obvious, and that's why you were laughing. Yeah, so it was obviously Dr. P.K. Vedantan, sir. So the same Mysore conference which I was speaking about, in fact, I heard Dr. Pendukar Anand there, I heard Dr. Sandeep Salvi, I heard Dr. Mahesh, I heard Dr. P.K. Vedantan, and then I knew that there was much more to do for this, and that's when I looked in for the next available program, the DA CMC Vellore, and that was it. And from there, the different journey began. Sir has been a mentor for me and for many, many others in our country. So he's like a father of father. You know what we relate him with. I think we also had a talk on the similar line, like Shankaracharya, where in a different all the different zones he has established one institute kind of a thing. Yes, he is definitely a mentor that I have looked in for. Of course, there are many other people who have held my hands along with him, Dr. Christopher sir, Dr. Vinay Mehta, and then all of you colleagues, yourself, Dr. Bala, Dr. Neeraj, Dr. Saibal has guided me many times too. So I'm very thankful to all of them.
Uh, Given that, I think allergy is not an established specialty in our country yet. I mean, there is gaining more traction or momentum in the recent years. Given that when you started your allergy practice, there was limited training opportunities. How did you navigate your way then? And just give us a brief input into that journey.
Limited limited resource was also an advantage because I didn't have to look. There was no other confusion, so you had to only get in there. So, but I also found it as an opportunity because there was not much people doing it. So I directly got into my next interest was to get into DA CMC Vellore and had a very good time, the great learning there. And that time, our batches were also used to be little small. I think I was a fourth or a fifth batch, probably. So we had a smaller batch. So even the post our class, we would have a lot of discussion. And once I gained the interest and once I started practicing, and that's when actually many a times Dr. PKV sir, Dr. Mahesh, and Dr. Vinay might have helped me in my practice. And then got introduced to little more into Yaki, so explored a bit more there, attended a couple of international conferences, started applying back what I learned into my practice rather than just learning or just for the reading purpose. So the limited resource was also an advantage that I didn't had to, I was quite focused only for that. I didn't have to search for too many things too. So
I think.
sometimes the problems of a scarcity, sometimes the problem could also be because of the excess. So I didn't have that excess problem.
Yeah, so I think you have, because many of us take limited opportunities as a hindrance. I think it's the inspiration also where you take that, as you rightly pointed, the scarcity of the opportunities or whatever the best we can make use of the opportunities we have can definitely leads on to good, greater things as well. Your journey has been very exceptional. Even I have very personally been seeing your journey, and it is quite impressive as a teacher, as a mentor, and as a colleague. If you had to relive one part of your journey, what would that be?
I would really think, Soumya, that I hope, and I'm really this thing that I have a lot of journey left to to tell, more on this question. But for whatever the journey that I have already had, probably that, the reliving that time of a student at Vellore was very nice, because I was into practice for so many years, and then again becoming a student, again writing an assignment, again sitting in the classroom giving exam, preparing for the exams, doing a group discussion. That was a great fun.
I think that speaks of your character as well. So I think you like challenging things and you make the best use of the opportunities. I think that's a very good message saying that age is never a factor. And if we have to learn that and master it, I think we should always be open to the opportunities.
Yeah.
What were the early challenges in your practice you found when you came into allergy practice in our country? And was there a particular case scenario or a patient where you thought that was it really fulfilling that you chose allergy as your practice?
Okay. So let me tell your first question. What were the challenges when I took up allergy as a practice? As a core practice, rather, actually. So I was doing a ENT general too, as a general practice too. So when I started my allergy practice, so that's probably around 16 to 17 years before now. Uh, so that time there were people who were practicing allergy, but there were very few. There were very few across country who were practicing allergy, and the knowledge wasn't spread. Okay, so how the allergy practice is done, it was still like a gray zone and a gray area for many. So the first challenge was the awareness that our peer colleagues had, or what is this, what we are going to do, what is this allergy shots, immunotherapy. People didn't have really a scientific knowledge behind that. So creating that was a big challenge, but that was also fun, and I enjoyed doing that. So I think initial few years of my practice, I did lot on education, whether it's in peer colleagues or whether it is in the schools, whether it is in a public awareness program, either in the newspapers or in a the sometimes even social media came only now, more in the radios or a TV interviews. So I think I have the first 5 years I have spent a lot on this, and also on a couple of rural camps initially, to create all this awareness. But I think keeping our treatment transparent and sharing it with our colleagues, and also teaching it. So whoever wanted to come, even at that time, we were quite open for them to come and see that how we were administering, what were our counseling lines, everything. So that was a challenge also, but that was also an advantage to pick up the practice too. So sorry, I just forgot your second
No, no,
question.
no,
You
no,
all.
absolutely. I think, as you rightly said, peer education and awareness also matters quite a lot. So, given that you ventured into allergy practice, when you saw any particular patient or a particular moment where you feel that it was really fulfilling that you chose allergy as your core specialty?
Not as a single patient, actually many patients for that matter. But two, three, if I have to really, which I quite often quote, is one elderly couple would meet me, who had undergone multiple surgeries, multiple sinus surgeries already. She also had a CSF leak in her last surgery. She is asthmatic. Her quality of life had become so poor, and she would restrict herself only to one room, and even making a coffee for herself was quite a big for her. And then we started, I was referred for allergy management. We optimized her treatment. We had to add her immunotherapy complement with the biologicals too. And then she improved so significantly that she would, go out, get a vegetables by herself, but she started socializing. And after 2, 3 months of her treatment, in fact, she made this big box of a rabdi for all our clinic people, and she got that. Was so
Nice.
satisfying to see the elderly couple being so happy. So that was a one thing. And the second, other very similar patient who had undergone multiple surgeries earlier, and then we just optimized his treatment. with the immunotherapy plus the biologicals. And then his anosmia, everything improved so much. Then this summer, he came and complimented us, Doctor, I smelled mango after so many years, and I enjoyed my mango.
So
I
nice.
know. And there was a boy, 13-year-old boy, who again was having a bad allergic rhinitis, asthma, poorly controlled. And again, for him, after optimizing the treatment well, and he was quite limited in his activity. He went for a Himalayan trek
Okay.
alone, not even with his parents. And when he came back with one big, the dairy milk fruit and nut. They're so rewarding. They're more rewarding than any of the awards that you get.
Correct. Absolutely. I think it is so inspirational when you see such patients, you know.
Yeah.
On the other hand, did you have to had your set of skepticism or any comments about your venturing into allergy practice from peers also? Though you mentioned that some peers were not knowing what was allergy practice or anything. So, any particular incident which has stuck with you that you had to face this criticism being in allergy practice?
Luckily, absolutely not, actually. So, uh, but only few, had a doubt that would anybody take allergy as their major practice. See, now it has become like, the field has become like a subspecialty, even in ENT. I'm sure that even in a pediatrics, so you do something more in a pediatrics again. People are either do rhinology, people will do either, skull-based surgeries and all, which looks more fascinating and more thrilling. So people were wondering whether you really would allergy itself be, you can take that as a major part of your this thing, but no, absolutely there was no hindrance, Dr. Sowmya. So it just probably, took off. So there was no hindrance at all. And I'm fortunate to have been supported by my ENT colleagues and pediatrics and physician colleagues surrounded by too.
Now, venturing on into the evolution of allergy practice in India. So, how has the public and professional awareness of allergic diseases changed over a period of time in the arena of diagnostics or immunotherapy, preventive care? What is your experience be?
Yeah. So over 15 years, especially the last decade, probably has really, gone up in certain factors. There are good parts, there are bad parts also. So coming to diagnostics, yes, the molecular diagnostics have come into picture. There are more in vitro tests which have penetrated into the market. Uh, so the good thing that we have all these tests available, but the bad thing is also that it has also penetrated to the non-practitioner and to a people where they don't know where to order for it. So that's also a challenge. Where I was talking about the problem of access now. So from the problem of scarcity. From a immunotherapy wise, there is a significant improvement in the quality of the allergens that even in the indigenous allergens, though that we are yet to have a standardized allergens locally from the local manufacturers here. But from whatever the quality that we have at present to the past that we used to have, there has been significant improvement in the quality. We have a standardized allergens also available now. We have approved allergens which are available for the sublingual immunotherapy, which is like a big step in our immunotherapy practice. Um, Also, allergy practice has slowly been introduced into a couple of medical colleges. So I see that medical colleges are having some allergy workshops. Most of our ENT conferences are having the allergy as in, at least a half-day workshop or a skin prick allergy test workshop. I'm sure that even in pediatrics that is happening now, which wasn't there 10 years before. So that's definitely the good progress of it.
And for people like me, pediatrics, I did not even know what is nasal wash, or we may have just theoretically heard. I think coming in contact with ENT people and specialized in allergy has opened up more avenues or made us more aware of the treatment options which are beyond pharmacotherapy also. So thanks to your awareness programs or educative initiatives, I think many of the pediatric colleagues would agree with me on that. So not only on that, I think you have been a pioneer or at the forefront of allergy education, especially in aerobiology and immunotherapy in India. Um, what are the biggest system level gaps you still believe need to be addressed? It could be in the training, the infrastructure we have, or in the policymakers in the allergy education in India.
Though that I mentioned that, it has entered a medical college, it's still only like, small portion of in the conferences or something. So if you ask any MBBS graduate about the skin prick allergy test, they would be totally be unaware of it. If you ask postgraduate who have finished ENT, who have finished pediatrics, who have finished general medicine, skin prick allergy test, the basic, I'm telling the two basic thing, okay? So they will not be aware of it. So it still needs to go into the medical education. That's unless it starts from our medical education, the awareness and the things are not going to change to a larger extent. So it has to start from that level, that MBBS to the post graduation, maybe a little more better training to then the fellowship programs. So now what is happening is you don't have those things, and then you directly have some fellowships and diplomas which are available. So the basic still doesn't seem to be very strong for the seekers who are wanting to do a allergy practice. That's one thing. Coming to probably the policy making and all, making immunotherapy in our guidelines, especially I would apply it more for immunotherapy. The pharmacotherapy, anyway, we have the well formatted even in our Indian guidelines. Things are there both from a pediatrics and the ENT end. But when it comes to immunotherapy, it needs to be a little more be refined, and we need to inculcate it as a part of our guidelines, how to practice is the ethical way of practicing immunotherapy, even the little more on the ethical way of using the diagnostics. So all those things have to come as recommendations from the national guidelines.
Yeah, thank you for that insight. I think that's an important thing. I think over the years, though the awareness has been very well taken off, I think it lacks still in the commitment at the policy levels. And given that commitment, I think we can see allergy education going more places. I know personally also you're a very good mentor, and since the beginning of your allergy practice, you were also mentioning that many of the colleagues or juniors shadow your practice also, and you're usually very welcoming. So I'm sure most of my colleagues or juniors would agree that you have been a very integral part in their allergy education. As a mentor in shaping the next generation of allergists, what do you feel their core skills must be, or the mindset of young pediatricians who would want to pursue pediatric allergy in their
Yeah.
practice?
Yeah, so definitely the mentorship plays a big role in your allergy practice, and you have a learning curve in everything new that you learn, and so also you have in your allergy practice too. And see, we should not only be a mentor, Dr. Sowmya, so we should also create mentors. So that's another thing. So we should identify people who could be like, what we would tell it as an Guru Parampara, in a ancient this thing, it is called Parampara. That means it is from one to one to one to, it's not that it ends with you. So you need to prepare many other mentors too. So that's the thing. So the mentorship has to become like, widespread, and you create many other mentors. And if I have to tell that what I have to tell to the younger pediatricians is start for the things are very simple. Don't complicate the things, and be more focused on the simplistic things, and be more focused on the most common problems that you have. Okay, don't go behind very fancy things or the rare diagnosis or something. So something which you see day in and day out, be thorough with that. It should be so thorough that you will do that even in your even in your dream, like whether it would be just a simple prescription of your allergic rhinitis to an well controlled asthma, starting from your prescription to the device demonstration to the history taking to the counseling or what is, be so thorough with a very simple thing. the bigger things will definitely happen. Okay. So, and just learn to listen to your patients. So I know that there are no symptoms beyond 5 symptoms in your allergy practice, 5, 6 symptoms, but each patient will have a different story to tell. And that each story will teach you a new thing every day. Every day. I'm sure that we all will learn one new thing in our practice every day from our patient. So our patients are our biggest teachers. So listen to your patient, and your healing starts with listening to your patients. Okay, so it doesn't come much from the pen. It really doesn't come much from the pen. Actually, the healing that you provide to, or the placebo effect that you provide to your patients, comes from listening and reciprocating with them.
I think that's a very well point you have made, Dr. Gayatri. I think just listening to somebody empathetically, I think is what we have to inculcate. And when we are very young in the practice and we are starting our allergy practice, I think it must not be the numbers you see, it's how much you can make a difference to those patients, even if you see. Given that you are involved in allergy education across the programs in India, if you were to design an ideal training program, what would it include?
Uh, Most of the things are which are already there. Okay, so we have seen that, but one thing which is lacking everywhere is a bedside training. So we see that most of our students come out, but with no confidence in the practice levels as such. They have a very good theory knowledge, but when it comes to practice or the core specialty, like the ENTs being confident in asthma management, ENT being confident in at least doing the basics of a pediatric management, pediatricians being confident enough with the ENT practice or the bit of an endoscopy. So that is still lagging because we don't do much of a bedside training in the training programs that are available in India. So maybe if we can inculcate bedside practice as a part of all these training programs, that would make a huge difference, and that will give them a lot of confidence in their practice too. How much ever that we have learned till MBBS, the internship was totally different, isn't it?
Correct.
So that's how it is.
Absolutely. I think the next few years for allergy practice in India is quite exciting. As you rightly said, we have so many uh, 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 innovations happening in diagnosis, the treatment options. Say 5 years down the line, what is your dream scenario you look for allergy care in India by 2030?
The allergy care, anyway, the worldwide it is progressing. So I just wish that we stand as an we were the country probably where the incidences were pretty low earlier, and now we are also moving to that kind of a number which the Western world uh, is progressing. So I hope that we do in our lifestyle something right, in our practice something right, so that we show the regression in number. So what Dr. Neeraj quite often tells that, easternizing the West. So we stand as a model to them that what is that we have been doing right, probably is right from our prenatal area to the pregnancy to the post, that, we stand as a model for them that, see, look, our allergy numbers are reducing. May not be good for me as a specialist, but that's maybe something that 2030 maybe still quite less number of years, but we still can do that. We can probably show that the easternization of the West and stand as a model to rest of the world.
I think um, in the spreading of allergy awareness in across the world, I think most of the subspecialties also have played a major role. I think what better, like Indian Academy of Pediatrics or Association of Otolaryngologists or other associations, you think can play a major role, and academic institutions in the spread of allergy awareness education in India?
So one is that that everybody questions whether it's an NMC guy, NMC approved, all those things. So MCI recognition. So we can work on that. That's a one thing. Second thing, the huge gap that we have compared to a Western world is in a research. So we have a excellent clinical practice. We are excellent clinical practitioners. So, but we are a bit poor in research. So I think under these organizations, we can and we have such a huge number. If you do a multi-centric studies, we can really bring out a big data. So these organization, if they can take a initiation in nationwide research, and also your IAP itself is like such a big family. So imagine that the two different specialities like ENT and IAP collaboration together, then how such a huge number it will be. So if we can produce some very good the research work from India, from such kind of an organizations, that would be really good. So by education also we have really improved, except that we have not penetrated much into the medical colleges. But the knowledge that has been created by the existing training programs is extremely good, but we are still not good at research level at all.
Absolutely agree. I think uh, as a collaboration, when we come together, I think it can definitely make a difference to our practice. I think, as you rightly said, we have very good clinical practice. I think just that sometimes just translating that into research is the commitment where we lack as I think that's a very important point to ponder on. Any global trends or innovations you think, as allergy practitioners in India, we should embrace more quickly?
We have been embracing pretty quickly, actually, more than required. We have embraced some, especially when it comes to molecular diagnostics. I think we have been more aggressive than what the Western world is doing, whether it's required or not. Bit more from the policymakers if they can make a biologicals little more affordable to our countries, because right now we are with a two or three, and that too for me with the ENT indications, I have only two biologicals available. I know that it could change a life of many people to make the biologicals little more easier. Probably in future we will see incorporating more of an AI into our allergy practice. Some technologies to make our patient more adherent, some more technological friendly things which can create a awareness, or the app based systems for our patients too. So I'm pretty sure that once it is there, we will quickly adapt into that. So we have been quite open to the newer things which are been available to us for sure, but it's only that the few things are not yet accessible. So if the policymakers can make it a little more affordable for our class of people, that would be really great.
Very great message. I really hope, I think it happens sooner and it would benefit our patients. I have few rapid fire questions, Dr. Gayatri. So, a myth about allergies you would like to bust?
That you need to live with allergies.
Okay, absolutely. One allergy tool or test you absolutely trust?
History.
Your favorite scientific journal or go-to resource?
I usually go for EACI journals.
Okay. One clinical pearl that you wish every pediatrician knows about?
Oh, I think I already mentioned it. Just to be simplistic in your, just listen to them. That's all.
A book, quote, or philosophy that guides your practice?
Not necessarily guide my practice. If you ask me about the philosophy, I often listen to Mankutimana Kagga. So, and one quote from that, if I'm allowed to say that, I will. Yeah, so it tells that ಹುಲ್ಲಾಗು ಬೆಟ್ಟದಲ್ಲಿ ಮನೆಗೆ ಮಲ್ಲಿಗೆಯಾಗು ಕಲ್ಲಾಗು ಕಷ್ಟಗಳ ಮಳೆಯ ವಿಧಿಸುರಿಯೆ ಬೆಲ್ಲ ಸಕ್ಕರೆಯಾಗು ದೀನ ದುರ್ಬಲರಿಂಗೆ ಎಲ್ಲರೊಳಗೊಂದಾಗು ಮಂಕುತಿಮ್ಮ. That means that be like a grass when you are embraced by a wind. Be like a hard stone in the forest when you are showered by the difficulties. Be like a jaggery to people who are poor and needy, and be like one among all. And if I one thing that I have to tell for the medical practitioner, medicine is not just the science. Medicine is always the science and art.
Absolutely. I think it so much percolates even into our daily life. Thank you for sharing that, Dr. Gayatri. If you weren't to be a doctor, what other profession would you have chosen?
Farmer. You give me till again, you give me now also 9 to 5. I will do a terrace farming and I'll present you a bunch of vegetables in a month.
Absolutely. And I think uh, thank you so much, Dr. Gayatri, for sharing your wisdom and journey. I think you're one of the very fine people I have interacted in the last few years of my practice and personally also. And it's been a pleasure always collaborating with you on academic events or personally also. And I think it resonates with most of our students and allergy practitioners across specialities. So, thank you for sharing your knowledge always very liberally, and you have no qualms about it. Wishing you uh, more honors, laurels your way in the field of allergy. And before we sign off, would you want to give a message for our young practitioners or a wish for the future of allergy care in India?
Yeah, sure. Thank you. Thank you, Dr. Sowmya. And it was lovely interacting with you as always. If there is another allergy specialist in India that I would look for is you. In fact, actually, I was thinking that I should be taking an intro for you on this topic. One message for the youngsters, see Swami Vivekananda always used to say that our youngsters are not useless. Our youngsters are used less. Okay. So you just need to guide them. They have a lot of potential. So just we also need to guide them and take them to a next level. So that's what just, understand your potential and reach to a newer heights.
Thank you. Thank you so much for taking time out from your busy practice and recording the interview with Allergy Legends for IAP National Allergy Chapter. Thank you, Dr. Gayatri.
Thank you. Thank you, Dr. Soumya.